Scapular pain is often overlooked in the diagnosis of cervical radiculopathy, a condition affecting over 200 people per 100,000 each year. Traditionally, clinicians have focused on neck and arm pain as the hallmark symptoms, sometimes missing the significance of pain around the shoulder blade. However, recent research challenges this narrow view. Comprehensive scoping review mapped decades of literature and found that scapular pain is not only common, but may actually precede arm pain by several weeks. This means that patients experiencing pain in the scapular region between or around the shoulder blades could be showing early signs of cervical nerve root involvement, even before classic arm symptoms appear. Recognizing this pattern could lead to earlier diagnosis and better outcomes for patients. Review analyzed 86 studies spanning from 1957 to 2022, revealing that scapular pain was reported in 72% of cases with cervical radiculopathy, making it the third most common symptom after neck and arm pain. Interestingly, the C7 nerve root was most frequently associated with scapular pain. The research also highlighted that pain patterns can overlap, with many patients experiencing neck, arm, and scapular pain together. Only a small fraction had isolated scapular pain. These findings suggest that the clinical picture is more complex than previously thought. By mapping pain to specific nerve root levels, clinicians can better localize the source of symptoms and tailor treatment. This nuanced understanding may help avoid misdiagnosis and ensure that patients receive appropriate care sooner. Implications of these findings are significant for both clinical practice and future research. Historically, many studies and diagnostic criteria have excluded scapular pain, focusing only on neck and arm symptoms. This approach may delay diagnosis and limit treatment options for patients whose first or only symptom is scapular pain. Review calls for a shift. Clinicians should document the onset and distribution of all pain regions, including the scapula, and researchers should include patients with scapular pain in future studies. Additionally, understanding the overlap between radicular and facet joint pain in the scapular region remains a challenge, highlighting the need for more mechanistic research. Ultimately, recognizing scapular pain as a potential early sign of cervical radiculopathy could lead to earlier intervention, improved outcomes, and a more comprehensive understanding of this complex condition.